Save it. So we are recording right now. Hello, everybody. How is everybody today? So we are going to be sharing the some questions that everybody sent in. It is the 27th of, I think it is, of June 2018. And I did get to see a movie last weekend. I'm not going to tell you which movie it was, but maybe you'll figure it out from our presentation. So some questions that we had come in, I adjusted them a little bit if this is your question to take off your name. But first one, hi, I keep hearing from my dentist that a cone beam CT scan is very low radiation and I shouldn't worry so much about that. Just get it done. Any thoughts on this? And what can a person do to help detoxify from this before and after? Well, a CT scan is going to give us radiation. Plus, a CT scan can give us other toxicities if we're using any contrast. I'm not exactly sure how much radiation a cone beam CT scan does versus a different type of CT scan. For instance, an abdominal CT scan gives you equivalents of about 50 to 60 X-ray equivalents of radiation. So that's a lot of X-rays. A thoracic would give you the same amount. A head CT is going to give you a lot of radiation. And it also, you have to look at where you're getting the CT because what organs are going to be damaged. Certain types of tissue are going to be more sensitive to radiation than others. The first one is going to be neurological tissue. So if you're going to get a head CT scan, you're going to have more damage to the brain and the neural tissue than if you had an abdominal CT scan. So you got to take that into consideration too. But all in all, you do have to weigh out. Sometimes there's the only way that you can visualize something is through a CT. An MRI won't pick it up. A CT is the only way to do it. So you got to weigh that out. And really where the radiation from a CT scan causes more issues is number one, if you've had a number of them. So getting one or two CT scans in your lifetime isn't going to be a cause of cancer in a person, most likely. I've had patients that have had a CT scan every 3 months for a year or so, and then some other CT scans, this is their 8th or 9th CT scan. Then you start really being concerned you're getting a lot of radiation. That's an enormous amount of radiation. So the number of CT scans is an important configuration. Also, there is a gene, your CAGC gene, that if you have defects on one of or more of those genes, there's 4 genes in that family, you're going to be more susceptible to sensitivity to radiation and EMFs. So if we've already run your genes and we don't remember if we've gone through that or not, just email me so that I can look at your genes, or call the office and we can look at your genes and I can give you that data. But that is another thing to consider. So if you don't have a lot of defects on those 4 genes, then you're going to be less susceptible to the damage of the radiation side of the CT. Now, if a contrast is being used also, then you want to address that. So first of all, going through this again, number one, should I get a CT? Well, is it the only way to really see what's going on, and that's going to dictate the treatment protocol? Then maybe it's a good idea. But then factor in, is this my 6th CT? Maybe it's not such a good idea. Is this not going to factor into my treatment protocol? Meaning, I'm not going to do anything about it anyhow, it's just for the doctor's curiosity? Well, then don't get the CT scan. But if it is going to factor into, if you remember my rule, so in any testing, if it's an invasive test, you don't do the test if you're not going to follow, if it's not going to change the way you treat the patient. But you do the test if it would change the way you treat the patient. I mean, you don't do the test just to satisfy a morbid curiosity. You do the test to dictate a treatment protocol that may change if if the results came back positive or something like that. So I'm not against doing imaging. Imaging can be extremely beneficial, and it can rule things out and change the way you're going to treat something. So, but and then you get to, now what should I do to help detoxify it? So we do have a radiation homeopath that can help. Remember, nothing's going to be perfect. So taking a radiation homeopath isn't going to pull the radiation out of your body, but it will certainly help. So if I was going to do a CT scan, I would do the radiation homeopath. And you can start after you do the CT scan. You can start a week before you do the CT scan. If you're getting a contrast, we have gadolinium contrast homeopath. That's the only contrast homeopath that I have right now. So I would need to know what contrast they're using. And if I could get it to make a homeopath out of it for you, I will do that. So what would you do to detox? You would use a homeopath to pull out the contrast. You use a homeopath to pull out the radiation. And then you'd support the liver detox pathway. So the PON1 pathway is the most important pathway to support in helping pull out the contrast. So that would also dictate part of my decision whether I'm going to get an MRI or a CT scan with contrast is, how are my detox pathways? And if you don't know your genetics yet, you don't know the answer to that. But if you do know your genetics, and we've gone over that, then you know how healthy your PON1 pathway is, or your NAT 1 and 2 pathway, your cytochrome P450 pathways. So if you need a review on that, just call the office and schedule a time for me or for Ann to go over that quickly with you. So that's how I would work on detoxifying it. Detoxify the pathways that contrast is going to go out on. Use a chelator in a form of a homeopath or some other chelator like modified citrus pectin or a chelax, which has EDTA and DMSA in it, and to help pull that out of your body once you're exposed to it. I need to get a dental implant done. Terrified that it will poison me. So that's a good thing. So dental implants are typically titanium, and typically, everybody, there could be exceptions to this, but typically people don't have reactions to titanium. Now I know there are some new techniques in dentistry where they're using porcelain as the implant. There's only a handful of dentists that are doing that, and that tends to be, almost nobody reacts to that. But I have not personally had anybody ever in my office that had a reaction to titanium. I've had people react to all sorts of metal implants for bones, nickel, and different metals that they use for for surgery, post-surgery, for reconstruction and bone reconstruction. I've had all sorts of horror stories about that. I've never had any horror story with titanium. So I, as much as I wouldn't be excited about getting that done to myself because I just don't like doctors. I don't know that I would be really scared about that. If you do have, great concern about that, and I know who asked this question is a local patient, if you could get a piece of the titanium for me to test you on, and we could test you on it to see if you're going to have a reaction, I'd even be more confident in moving forward. And as far as detoxing, I don't think you're talking about detoxing the titanium implant, but you are going to have surgery, which is going to be some medication that they're going to put in for anesthesia. However, they're going to put you out for the surgery. And yes, we're going to want to detox that. So we detox that similar to what we talked about here with CT scan. We don't want to know if it is a specific product that we can create a homeopath out of, then that will help. And secondarily, supporting the different detox pathways. What can I do about my body ramping up the histamine issue with trying to heal? The histamine will be ramped up not so much when you're trying to heal. You could have an increased inflammation and histamine ramp up because of a reaction to the anesthesia or something like that. But the biggest thing that's going to be ramped up when you're trying to heal is your mTOR pathway and your IGF-1 pathway. It's difficult to slow that down with anything specifically, but there's some things just supporting autophagy that will indirectly slow down the mTOR pathway. So we can talk about that if you go forward with that. Next questions. Is there any RIFE programs to run on eczema besides the one titled eczema? So I have not had a lot of success running the RIFE programs on eczema for eczema. What we've had success with, we've had a lot of success with eczema in looking at some of the possible causes of eczema. Common causes of eczema are heavy metal toxicities. And as we improve your detox pathways and as we start pulling that out, the eczema tends to improve. However, so we got to look at the causes. A person can have rashes and eczema because they're detoxing through their skin because they have a lot of toxins to detox that are overwhelming their liver detox pathways. So if your liver detox pathways are overwhelmed because of an excess amount of toxin, then you can end up with skin issues. If your liver detox pathways are overwhelmed, not so much from an overabundance of exposure to mercury or something like that, but because of a lot of defects on those pathways, so you already have very, very sluggish detox pathways, that's the person that has had eczema since they were a kid, on and off. Typically, they have a lot of genetic defects on their detox pathways. So they always had very sluggish detox pathways. And the truth is, if that's you, then you would have done very poorly on today's vaccination schedule, where if you're 50 years old, you received probably 6 vaccines when you were a child. Today's children are receiving 40 to 60 vaccines. The amount of toxic exposure to heavy metals and dangerous chemicals that they use as adjuvants in those vaccines are what are causing ADD, ADHD, and Asperger's, and all sorts of problems, brain-based issues for these kids. And the kids that it's causing problems with are the kids that have these kind of defects. They don't detoxify these chemicals very quickly at all, so they end up settling in the tissue, and since little babies have no blood-brain barrier, they cross the blood-brain barrier, and toxins are going to settle in fat cells more readily than any other cells, and they're going to settle in the brain, and they're going to cause all sorts of problems. So if you were born, if you have eczema issues and you were born later, then you are going to be more prone to problems because of an increased exposure to toxins. And even today, we're exposed to more toxins, take vaccines out of the picture than we were as little kids, just because there's more in the environment. So you want to look at supporting detox pathways with eczema, and I would consider doing more of the foot bath programs with the Clearline Detox for the eczema. Also, there's some topical things that can be extremely helpful for eczema because many times it's a biotoxin. So using grapefruit seed extract, not grape seed extract, but grapefruit seed extract can be very beneficial. You can get that in a pill form or a liquid form. We have them both in our store. Or you can buy them online at Amazon as well. And that can be a good product by putting a couple drops on your finger and rubbing it on the eczema. Cannabis oil can be very good. CBD oil can work well on eczema. Rick Simpson's THC oil, if you have that, put a little drop and put that on the eczema. That can be extremely beneficial for eczema. Also, we have the Walkabout Emu oil. That could be beneficial for eczema. The curcumin cream could be extremely beneficial for eczema. These are all topical things that I'm talking about. But as far as running a Rife program, I would say doing the foot bath with some of the detox programs are going to be your best bet for eczema. What are the most powerful protocols we can do to get CT, PET scan, or MRI out of our body? Well, I kind of went over that of supporting the detox pathways. And if you are using contrasts with these, which most likely you are, then if we could make a homeopath for those contrasts and support the PON pathway and the NAT pathway, that's going to be our best bet to get that out. Also, go back to trying to pull it out other ways besides, taking some pressure off of our liver can be extremely beneficial. So using the foot bath can be very beneficial. Using a sauna could be very beneficial. So that's the benefit of that. So use the detox programs in that. And then the last question here, would medicinal mushrooms potentially feed yeast or candida? Potentially, yes. I have not had that happen. I don't think that's a problem. You're not giving it a fungus. If you have candida, you really shouldn't be eating mushrooms. But the medicinal mushroom blend is a dried mushroom. It's not going to have the same issue. So no, with candida and yeast, you want to be careful with sugars for sure, mushrooms and those types of foods, but the mushroom blend should not be a problem at all with that. And then some children are getting life-threatening illnesses. Oh, yes, they are. A lot of more children are getting cancer than like crazy here. Is there a reason not to have the Navarro HCG urine test done proactively for a child? And if you don't know what the Navarro HCG test is, that's a urine test that you do that you send off to the Philippines. It takes a while to get the results back, but they give you a score and it tells you whether you have active cancer or not. It's a very accurate test. We've had patients do that very regularly and have really good success with it. So it's a very accurate test to do. And I don't know what they recommend age-wise, because it is measuring human chorionic gonadotropin hormone, and I'm not really sure what age limit there is. I would think I would have to look that up, but I would think that if they're over 10, you can certainly do that. Questions that came in: could the homeopathics for the CT scan detox also affect the effectiveness of the chemo? No, not at all. Nope. So it's just totally different. It's homeopathic specific to the radiation. Number 2 is in one of the videos, Dr. Connor says the Rife will revert cancer cells to standard cells. So how does the Rife work? Is it really reverting a cancer cell to a standard cell? Well, let's understand what a cancer cell is. It's your normal cell that's in a rapid reproduction phase. And if you can get it to stop reproducing, then it really isn't, quote, unquote, a cancer cell anymore. It's just acting as a normal cell. Yet in the article he wrote in the protocol binder, it says Royal Rife had experience with the killing cancer cells. So yes, there's multiple ways that the Rife works. So therefore, I'm not sure which is right. Well, both of them are right. If reverting to standard, it does not seem like a good idea to debulk the prostate by lasering out perfectly good cells. Well, that is true, and I understand your issue. My prostate is enlarged, and it's causing issues because of its enlargement. Does this mean that I will have this condition the rest of my life, and then I'll have to catheter the rest of my life, etc.? The only answer to that is, honestly, is going to be time is going to tell. So on some cancers, so let's just talk about the prostate, but this goes for every cancer, that it's actually going to shrink. So as your body is starting to break those cells down and it starts to go through apoptosis, it's going to shrink. On some, it's not going to shrink. It's just going to stop growing and it's going to stay that same size. Now, if that's true with prostate cancer and you're already catheterizing, it may not shrink. And we're going to have to talk about either removing that surgically, doing some surgical intervention, some sort of stent put in, catheter the rest of your life. Yes, so that is a possibility. So only time's going to tell on that and answer that question. But multiple ways cells die when you're treating cancer: cell lysis, cell apoptosis, or the cell just starts functioning as a normal cell again, and it stops reproducing, or the cell dies and the body walls it off. Now that doesn't, I've not had that happen with prostate cancer. I've had that happen many times with breast cancer and quite frequently with lung and liver. That's a quite common occurrence. And then you are just going to have a mass there that's, like you see a mass that's 7 millimeters across in the liver, and it's stayed that way for the last 7 years. So that means the body's just walled it off and it's just dead tissue on the inside of there. And if you wanted it to go away, you'd have to surgically excise it. So we may have to use some other intervention in that case. Okay, so I am going to unmute everybody and open it up for questions if there's any other ones. So everybody is unmuted unless you mute yourself. So if you do have questions, you can ask them, but be careful what you have going on in the background.
Dr. Connors, this is Deborah Swartz. We have the industrial wind turbines going up around our home. Approximately 160 are probably going to be built if we don't get them. Anyway, the EMFs coming off of these things, how dangerous are they?
I have not seen any figures on what those are producing as far as electromagnetic frequencies. I don't think that it would really be a big EMF issue. So a wind generator is just generating electricity, and they're trying to prevent as much loss as possible, and it's going right into the system. So I don't know that it's going to be a big EMF production. There's other environmental factors I know with it. It was kind of ironic that everybody was screaming like blazes when BP oil spilled all that oil in the Gulf and all those animals passed away, and it was horrible thing for the environment. But what they didn't tell you is all that they have down at the Gulf in the water, they have all these wind turbines, just crazy amount of 1,000 wind turbines or something. And they happen to build those in the migration line of certain birds. There's more birds and flying animals killed from the wind turbines in 1 year than that BP oil disaster happened. So, and that goes on year after year. So trying to do things wisely to produce energy doesn't always work the way we want it to work, unfortunately. So we're not always as friendly to the environment. Now, I have heard rumors of other issues with the wind turbines, and quite honestly, I can't recall what they were. I can't remember if it was an EMF issue, though. I think there was other issues with it, but I can't recall what they were. So I'd have to look that up. You could look it up too. Just Google, and maybe they do produce a lot of EMFs. I'm not sure. The problem with EMFs and trying to get rid of EMFs in your environment is it's a nightmare because we're exposed to so many EMFs. We could use things like the products, those static products that we have in our store. We could use support for our cell phones and our computer devices, but nothing is going to block all EMFs in your environment. It's just not possible. So, and then now what's the really scary thing is the 5G that's coming out with our cell phone system. There's belief that that's going to cause an enormous amount of disease, and our cancer rates are going to really spike with this 5G technology. There's no knowledge of what's going to happen. We just got to pray that it's not going to be as bad as we think it is. So.
Okay, they just have these really huge, just if you want to say telephone poles or electrical poles, they're like 3 times the height of the wooden or the tree ones, and the lines on them are unreal. So that's why
that's going to produce a lot of EMFs. That's just in the lines that are carrying electricity that's produced. That's going to produce a lot of EMFs, and I'm sure they have transformers that are changing the 12 volt to 120 and to carry it and such. So that's going to produce a lot of EMFs.
They have, They have also added a lot of, try to say, electrical power stations.
Right.
So it's not a good thing. All right, thank you.
Dr. Connors, this is Ken Rosentrader from Alaska. I was there a couple weeks ago.
Uh-huh.
And maybe this is too personal or narrow a question to ask, but you probably don't remember because you write so many protocols. But I just wonder if you might happen to remember, is in the one you wrote, did any of them address chronic kidney disease?
I do remember, and it didn't. And I just mentioned that to Michelle because I saw you email that question.
Oh, okay, thank you.
Right? So I think we're going to send you another flash drive. We'll update your program.
Oh.
We'll put that in, and we'll send you a flash drive with instructions on how to download it in the computer so you'll have it.
So there is a possibility of help.
Well, of course there is.
Well, I didn't know how far it went. So
could tell you're new here.
Yeah. Well, I just didn't know how far Rife went. That's great because the whole conventional wisdom in the medical field is once kidneys are hurt, they can't be helped.
Well, I know that is, and it's because you gotta finish the sentence that they don't finish. It can't be helped with drugs that they have right now. Yeah. So your body can heal those. So we're gonna.
This is very okay. This is very encouraging. Thank you. Okay, I won't take any more time. Thank you.
I sent a chat question about if you're getting gassy from certain foods, does that alone tell you shouldn't be eating those foods? And, for example, onions, garlic, peppers, cabbage, those are the typical gassy foods.
It means you need to tell me after you eat that so that I don't hang around with you. So, not necessarily. So with the onions and the sulfur-containing foods, if you get really gassy from those, it can be because of defects in your transsulfuration pathway, the CBS genes, because you're just dumping that really quick. However, it can be, and more than likely is, due more to enzyme deficiency in your gut. So if you just tried to take a digestive enzyme when you eat those foods and see if that makes a difference, I would try that first.
Is that what like the Gas-X and everything is supposed to do?
Yeah, well, Gas-X is just an enzyme.
Okay.
So there isn't anything wrong with using that. There's just some better enzymes on the market, but using a digestive enzyme when you eat your meals is very beneficial. Matter of fact, there is a really neat research paper that came out last year with pancreatic cancer, and because just pancreatic cancer, just like any other cancer, has been on such an enormous rise, and the paper spoke about one of the thoughts of why the rise of pancreatic cancer is because our diet is so poor that our pancreas has had to so be upregulated to produce enough enzymes to break down foods that it can't do its job. The average size of the human pancreas has gotten larger over the last 50 years. I don't know where they got all that data, but they went down through post-mortem studies. And that was one of the things. There was a hypertrophied pancreas due to trying to make enough enzymes that it can't keep up to. So taking digestive enzymes can be extremely beneficial for not only digestion, but it takes a lot of pressure off your pancreas.
So I assume you have a product that would be better than Gas-X.
We have numerous digestive enzyme products. So it really depends on any other issues the person's having. So we have a digestive enzyme with HCl in it. We have so that's if you have, you get a tummy, you feel like you get a little tummy ache after you eat, or you feel like your food is kind of sitting in your stomach. You need some help with hydrochloric acid. And I shared my entire screen here, so I can actually just go to our store and show you these. And we have, so if that's not an issue and you just want a straight digestive enzyme, then I would typically use the Digestimes. We have several brands. One of my favorite, I got them as the featured brands here too, so it's easy. My favorite brands are the US Enzymes because I know the guy who runs this company personally, and he's like so crazy anal with perfection, like drives you nuts. Myself and a friend of mine are the ones who developed the Sun Spectrum, and US Enzymes makes it. So I wanted to develop the product with them because I knew we were going to get there's going to be no product on the market that's like it. So that's a US enzyme product, the Sun Spectrum is. But so they have multiple enzymes. They began as an enzyme company, right? They have this Cleanzyme, which is really good to help detox with your liver and such. The D3zyme, I'm kind of phasing out because we're going to have a talk on D3 next week. The Proteinzyme, that's a protein powder that is absolutely the best protein powder on the market. This is the HCl-zyme, so if you feel like food is kind of sitting in your stomach and not going any farther. And then the Digestimes are this product, right? Let's see where it is, right here. So this one is a really, really good digestive enzyme that if you just want to help with digestion, take some pressure off your gut, and help clean out your gut, this will help break down anything that's caked to the inside of your gut walls. That's a great product to take with meals or on an empty stomach to help break down junk in your gut. Okay, any other questions? So what movie did I see this weekend?
The Incredibles.
Did anybody else see it?
No.
What? Oh my gosh, where is your super suit?
I saw it twice.
Oh, all right. That's good.
I loved it.
Questions? It was a great movie.
Dr. Connors, I have a quick question. Going back to the enzymes, I'm a type 1 insulin-dependent diabetic of like 32 years. And so since one of the major functions of the pancreas is digestive enzymes, is that something that I should be using on a regular basis? I don't normally have problems with, indigestion or, digesting my foods that I've ever noticed, unless I'm eating a heavy meal like really late at night or something. But
So type 1 diabetes is an autoimmune disease your pancreas has two different types of cells in it. One that makes insulin, one that makes enzymes. It's type 1 diabetes is an autoimmune disease where you have antibodies against the cells that make insulin, not the cells that make enzymes. So if you have If you have type 1 diabetes, does that mean that you really should be on enzymes? No, it doesn't. However, should everybody be taking enzymes? Probably yes. So it does take pressure off of your pancreas. And even though it's not the cells that are making insulin, it still takes pressure off your pancreas. So
Okay, so is that like a general one that you would use? Or
this is a general one, but it is like the reason why I like it so much, it's like the best general one that you could think of.
okay.
So I take this one. I also have the HCl zyme in at home, but I don't take that very often since I used to be when I ate meat. I don't eat any meat anymore, but when I ate meat, I used to take this. Or before I use this company, I use the company called Standard Process. They have a product called Zypan, which is a good product too, but it just doesn't hold a candle to this. I used to take that if I ate meat or if I had a bowl of ice cream or something, I get a stomach ache after. Well, I don't eat dairy anymore and I don't eat meat anymore. So I really don't take this very often. I don't feel that like, oh, I got something like what I just ate was too much kind of sitting in my stomach. I don't get that feeling anymore, so I hardly ever take that.
Should I be specifically tested for these, since I tend to have issues with anything I take by mouth?
Yeah, we should. We could do distance testing on you. So just call and tell Jen or whoever answers that.
Okay, great. Thank you.
All right. So next week, we are not going to have a live Zoom call. We will be posting a Zoom call but it won't be live, so you won't be able to get on next week because it is the 4th of July. So you'll see something posted on Facebook, but it won't be something you can ask questions. But you can ask questions on the email. So just email me questions and in the subject line put Zoom call question or Zoom call or something like that so that I catch it. Remember, literally I get 100 to 150 to 200 emails a day, and if it could get buried. So if I don't see Zoom call question on there, it's definitely going to get buried. And even if you do, it might get buried and you have to make sure you remind me again. But it won't be live, but we'll get a Zoom call posted up on Facebook. Feel free to keep asking questions on Facebook and utilize that and help answer other people's questions. And one of the biggest things that I ask is that you become a prayer warrior for everybody. I think I posted, I don't think I posted it on the group page. I posted it on just the Connors Clinic page, I think. This little boy, he has to be about 2 years old, and I can't remember. I think he has a horrible kidney disease or liver disease. This poor little guy. The mom was washing him in his tub, and she was talking to him. And he just turned with the saddest little face. I just think of him literally since I seen that video a week and a half ago. Think of him every day, and it just makes me not worry about my day so much and my struggles or my pain or my problems. It just reminds me just to pray for that little guy. And then I am reminded to pray for all you guys, because that's where we really see the power in our life and see God use us in different ways. And we see healing come in our life when we start turning our needs inside out and start praying for others. So we've had this week and the week before some trials in our family of patients that they're going through things that may not have the greatest outcome. We don't know, but we need to be prayer warriors for one another. So if I could just encourage you to do that for one another, I think that you'll be blessed because of that. All right, so thank you guys very much. We will talk again very soon, and continue to send in your questions.
Thank you.
And go see that movie.
Have a good night.
Bye-bye.
Thank you.
Bye.
Bye-bye, thanks.